Well, good morning, everyone. It is Monday, August 31st. It's a double whammy. It's a Monday, and it's the last day of the month. So just as a reminder, do you know where your new clients are? That's the magic here, right? So any leftover prospects, any leads that you were working, make sure that you put a little pressure on them today and say, hey, if you really want that September 1st effective date, we got to get it done today. Let's get them enrolled today. So clean up that month. Let's get the last enrollments in and make sure you got your I's crossed and your T's dotted, as I like to say, and we'll get the month started right. So it's a fresh start. Tomorrow, everyone's back at zero. Wah, wah, wah. No, just kidding. It's a new start. That means we have new possibilities, new opportunities, and more money to make, which I'm excited about. All right. So a little bit of housekeeping here this morning. Jessica in contracting is back. She's back. We missed her. She was gone for a week, and I'm sure she missed us as well. So she'll be going through her emails and her voicemails and phone calls. So we appreciate your patience as she gets caught back up. So if you have any contracting, certification, training, and she hasn't quite responded, it was because she was on vacation, but she's back and she is here to serve you. So just give her a little bit of time and she'll get back to you. She's going to answer those messages and calls in the order they were received, unless we have an urgent on fire issue, which hopefully none of you have, so we'll get through it. But Cindy is going back out, and so she will be out of the office. And so we're a little short-staffed, but we're working through it. I'm making sure everyone gets their time off and comes back well-rested to help you throughout AEP, and we all are successful together. So we appreciate your patience as we do a little bit of HR. But with that, let's jump into the training sessions. Looks like a busy week for training. And I'm going to talk a little bit more about, the importance of getting all these trainings out of the way. This morning at 10 o'clock, Aetna is doing their specific training for Central Florida. So if you're in the Central Florida market and you're looking for Aetna training, you can jump on that at 10 o'clock. The links are all in our training calendar. Everyone should have this training calendar on their laptop, iPhone, their phone, or iPad, whatever they're using. To make sure that you've got that bookmark so you can get to this training calendar. At 11 o'clock today, Devoted is doing a coffee hour. So although it is Jamie from the West Market, he will answer any questions and all questions about Devoted, and he hosts that at 11 o'clock every Monday. So I hope you join that and get some great tips. All right, Tuesday, it looks like September 1st already. I would say the training of the week is going to be the Humana Marketing and Resource Center that they have. They're doing a training on that on Tuesday, tomorrow at 10 a.m. They're also going to train you on how to do your mailers from that and how to do social media training. So if there's one training that you get to this week, it would be the one at tomorrow at 10 o'clock. I think that one is definitely going to help you with your marketing and advertising coming up this open enrollment. So be on that one. Wednesday, the 2nd, September 2nd, United Healthcare is doing their virtual rollout session for their partners in care, and this is global for anyone, anywhere that sells United Healthcare. That will be on Wednesday, September 2nd at 11:30, and that'll go to about 1 o'clock. So that's a virtual rollout. They're going to be talking about their partners in care program. Also at Wednesday at 2 o'clock on the 2nd, you've got Aetna doing another Central Florida training, so you have the ability to jump on that and get your training and certifications done. On Thursday the 3rd, Jacksonville, you will have a coffee and chat talk with Devoted. So again, anyone that sells Devoted is welcome, but they may have some specific Jacksonville, and you'll be able to meet the Jacksonville manager there as well. Thursday the 3rd at 1 o'clock, Care Plus virtual enrollment tool training class. If you are selling anything Medicare, you need to be familiar with how to do those enrollment tools. We'll talk more about that in a moment. Also on Thursday at 2 o'clock, Humana is doing a training class in Spanish at 2 o'clock. And let me see if I can pronounce this correctly. Aspectos Esenciales de Humana 2021 AEP. Mi español es muy bueno. So, with that, if you would prefer to have the Humana training in Spanish, that will be at 2 o'clock on September the 3rd, that's Thursday. And then also on the 3rd, at Thursday, United Healthcare is doing another rollout session experience at 3:30 on the 3rd for their Partners in Care program. So if you can't make the one on Wednesday, they're doing it again on Thursday. Last training of the week on Friday, 10 o'clock in the morning, Aetna is doing their Central Florida product training as well. So that's the trainings for the week. Please make sure to subscribe to our YouTube channel to make sure you know what's going on in the week. And if not, make sure you got that training bookmarked and ready to go on your phone, iPad, or laptop. All right. So I have some exciting news. I always like to start the call with good news. Health plan markets, our team was awarded not one, but 2 top producer awards for 2 different companies. So the first one came a couple weeks ago, and I guess I forgot to mention it on the call. Bright Health awarded us with top agency for 2019. I want to thank everyone that's been working together and selling Bright Health. This is a team effort. This award is for you. So congratulations to our team for being the #1 agency for Bright Health in the state of Florida. Congratulations. I'm so excited for our team. That's a big award. And then the second award came last week as a surprise. Ambetter awarded us as a top producer for 2020 ACA business. So thank you to the team and congratulations. That's an amazing achievement. You guys worked so hard, and very, very proud of the things that you guys have done with both Ambetter and Bright Health. On that note, I know many of you are looking to add ACA products such as Ambetter, and if you've talked to Jessica or myself, if you're looking for a contract with Ambetter, they require you to basically put a commitment of 100 applications in a year. And for many of you, that may be impossible because you just don't do that much ACA. So with that, if you're still interested in doing Ambetter, we have a workaround where you would actually use the agency portal to do your Ambetter enrollments, and you would get paid exactly the same as if you had a direct Ambetter number, because they do require health plan markets to pay your commission on their behalf direct to you. So we do that every other week for commissions. So if you are interested in doing Ambetter, there is a workaround on that, and we can get you set up with the agency so that way you can do your enrollments through there and help people get Ambetter if that's what they need. Bright Health is going to be a hot plan this year, especially on their Give Back PPO product. Those of you that had missed the rollout sessions, they are hosting some additional rollout sessions for Bright Health, and they really knocked it out of the park on their HMO. But more specifically, they came out with a very, very unique animal with their Give Back PPO product here in Florida, up to $80 back in your Social Security check every month, and you get to go to anywhere you want as a PPO product. I mean, come on, what more do you want, you know? So I just think that that's going to be a killer plan, and those that have that in their portfolio are going to be bringing home the bacon, because I think that's going to go over like, like sliced bread. People are going to love this thing. So just make sure you get your contract done. Since Jessica's back, you can send in your request, and she'll get your contract started. We'll send you out the link, and you are good to go. All right, so in other plan news, Humana Medicare Supplement Plan G is now available as of August 1st. They sent out an email a while back, but I know many of you are swamped with emails and you didn't get a chance to read it just yet. So I wanted to point that out, that if you are doing Medicare supplements, Humana Supplement Plan G is now available in select areas as of August 1st. So if you know how to do a supplement, there you go. You got another one in your portfolio ready to go. If you don't have Humana Supplement, just shoot Jessica an email and we can send you out the links to Humana. If you have Humana Medicare Advantage, you automatically have the supplements, so don't worry about that. If you need training on the supplements, please reach out to Tom Ryan and we'll connect you and possibly get a training on the training calendar for everyone else. So if you do need training, please let us know and we'll be glad to assist you with that. All right, a little bit of house cleaning here. It came up a couple times in the last week or two where I'm hearing folks out there helping people with Medicaid, and I think that's fantastic. But one caveat is I know that you may have a favorite company that you like to verify Medicaid with, okay, or even LIS for that matter. And if you've been doing this for a while, you may have noticed something. If you call into, let's say, Humana and you verify the Medicaid with Humana and they tell you that the member is QMB, and then, you know, throughout the presentation they switch gears and then they say, I really want WellCare. And you call WellCare and WellCare tells you, no, they're actually a full Medicaid member. So you're probably scratching your head, well, wait a minute, Humana told me they were QMB and WellCare's telling me they're full Medicaid. Well, what's going on here? So what's happening is Medicaid has their own system where they keep all the data, right? And then they allow these companies to connect into their system. And so Humana has a connection and WellCare has a connection. But WellCare and Humana have very different systems with each other, right? So whatever their system reflects may be faster than the others. So in that situation, it could be that Humana has not synced their data as quickly as WellCare has synced their data. So maybe the member actually got better benefits quickly or faster than Humana was able to reflect in their system. So why is that important? Well, if you were to make the mistake of enrolling your member thinking that they were QMB into WellCare, they're going to be missing some benefits because they're going to be better off on their WellCare full dual plan. Okay, so the moral of the story is this: if you verify with one company, that's fine, but the company that you're actually going to do the enrollment, please just re-verify that Medicaid with that exact company, because it may differ from the company that you always do that with. I see that a lot with Freedom. You know, Freedom's very easy to check Medicaid, but it can get you into some trouble because Freedom may not reflect the same information as the other carriers. So just a word of thought so you don't get jammed up. Please make sure you re-verify that Medicaid with the actual company that you're going to be doing the enrollment with. Okay? All right. So blah, blah, blah. We got through that. All right. Hope everybody's still awake. So let's talk about AEP, because guess what, guys? It's 30 days away. Can you believe it? So pre-AEP starts on October 1st, and it ends on October 14th. And what do? Do we go home? Do we go to sleep? Do we wait until October 15th? No, that's a big mistake. So I'm going to talk to you this morning about what you need to be doing to prepare for pre-AEP and AEP as we get through the holidays here, okay? So first thing is, and I've been harping about this for weeks now, please make sure you get your certifications and trainings done and out of the way so you can focus on marketing and advertising. If you have any lingering trainings, if you have any lingering tests or face-to-face requirements, get those done. Get it out of the way. Focus on that. Knock it out. And so number one, make sure that you're getting your certs done so you're ready for AEP. But number two, you don't have to worry about it, okay? And you get your commissions, and all your residuals will continue to come back in. So please make sure that you've got your certifications and trainings done and get that out of the way. While we're on the topic of training, this AEP is probably going to be the most unique out of all of the AEPs since the first one. And with that, you know, we have remote, we have social distancing, we have people that say, I don't want you at my house. Let's do this over the phone. Let's do this by mail. Let's do this, you know, by email, whatever it is. But here's the key, guys. You have to learn the systems. You have to learn the enrollment software systems. And there's a lot of them out there, and I know that. And each carrier has their own. But I will tell you that you will make your life a lot easier if you start to study them now. And we don't expect you to memorize everything, but take great notes, attend these trainings, and know these software systems so you're able to do enrollments, okay, remotely. It's all about efficiency at this time. And I'm going to talk about strategy, and I talked to our New Jersey team this morning about strategy, and I apologize if any of you are on the call and are listening to this again. But strategy is important, okay? The remote efficiency is going to allow you to not burn your windshield time, okay? Because you could spend hours, even days in front of the windshield driving from appointment to appointment to appointment to the appointment. And using social distancing now allows us to be more efficient. So you're saving yourself an hour, sometimes more time in traffic per appointment than being able to sit at home and call your clients one after the other, after the other, after the other for maximum efficiency and marketing. So make sure that you have that in place, because the remote efficiency and making sure that you understand these systems for enrollment purposes is going to be key to your success. And I strongly believe that the agents that adopt this now and take this on as your own are going to have the best AEP they've ever had, just because of the efficiency aspect. You're able to do your prospecting, you're able to do your advertising, you're able to do your scope of appointments, your full presentations, and your enrollments all online, all away from the actual member. So those of you that adopt this will be able to have the most efficient AEP we've ever had. So I'm really excited about that. So, and we're going to talk about strategy on who you should be attacking through pre-AEP and AEP. But before that, some more preparation. Do you have all the business cards you need? Do you have your car magnets? Do you have your brochures? Do you have your flyers ready? Do you have your polo shirts ready? What is it that you need for AEP to ensure that you have a successful run? If you're waiting until October 1st to order business cards, you're going to be in trouble, because it takes 2 to 3 weeks to get those business cards in your hand. Okay? So now's the time to ensure that you make a checklist to ensure that you have everything you need, marketing material-wise, to have a successful AEP. Okay? So get that stuff ordered. You know how to do it. Your team members will be reaching out to you to ensure that you have what you need and placing orders to get you ready for AEP, okay? All right, so let's see here. So first, I'd like to talk about our veterans or our intermediary agents, those of you that have been doing this business for a while and have any level of clients, okay? Whether you have, 10 clients or 100 clients, it doesn't matter, because the strategy is the same. So right now, starting August 31st, you should start calling your book of business, okay? Some of you are lucky enough to have, one of our team members helping you out with that. Some of you, it's just easier for you to call them. If you have less than 50 members, it's just so much easier just to knock out the phone calls. It'll take you an afternoon to do 50 phone calls, okay? But get those phone calls out and start talking to your members and saying, hey, look, I've had some sneak peeks on the benefits for 2021. I want to let you know that some things are changing, and I do want to come out and instead of coming out this year because of social distancing, I do want to get together with you over the phone for an appointment. How does that sound? And if they tell you, look, I'm really happy with my Bright Health plan and I don't want to change, or I'm really happy with my Devoted plan and I don't want to change anything, then great, no problem. You're going to get some information in the mail anyway from the carriers about your changes. If you have any questions on that, please give me a call. It's about that relationship. But you will have conversations with your book of business that go a little more like this. Yeah, Justin, I'm really, really upset. I don't like my Aetna plan. I want to change it. My meds are too expensive. You're going to have to change that member, right? And you can do your needs analysis now. You can do your research on the doctors. You can do your research on the medications. And then you have a sneak peek of all the plans. They live in the Gold Key, so you have all that. And you can go in there and kind of already pick out the plan that you think is going to be best for them. Set your appointment for October 1st, because you can do an appointment on October 1st. And you're going to attack your book of business from October 1st to October 14th, and you're going to be setting appointments for yourself remotely so you can start talking to them about their specific plan and getting them set up. Now, The only thing you can't do, the biggest no-no, is you cannot take an application during pre-AEP from October 1st to October 14th. Now, there's two ways to attack that. The first way is before, what I would do is I would go out and see all my members, all the ones that I needed to change, and I would, go do my scope of appointment, do my presentation, and then I'd actually help them fill out the app and leave it with them and tell them that, okay, on the 15th, you're going to sign it and date it here, and you're going to send it to this address and this pre-envelope, and you're going to send it right to me. Or if you prefer, I'll drive around and pick it up. Now, for efficiency purposes and social distancing purposes, the latter is probably not the best idea driving around anymore. But you can do mail-back applications, and that's what I was describing there, is what we call mail-back applications. You're putting the entire kit together. You know what plan you're going to put them on. You send it to them in the mail with a pre-stamped envelope, ready to go, addressed back to you, and then mark where they sign. And then on the 15th, you should be starting to receive application after application after application in the mail back to your house, or P.O. box if you prefer. Or if you prefer even further, you can send it to Health Plan Markets and we'll process it directly to you and for you. We do need your signature and the date on that application, but we will let you know when it comes in. So there is ways around that for folks that are not savvy with the electronic applications. But get your book of business done and out of the way from the 1st to the 14th. You don't want people popping up in the middle of AEP and saying, I changed my mind, I want to change my plan. So it gives you a little bit of time to get your clients in order. Now is not the time to go to Mrs. Jones's house and sit there for 2 hours and talk about the cats and the kids, and then spend an hour and drive to Mr. Smith's house and talk about the kids and the job and the retirement. Save all that for after AEP. Save all that for after AEP. You want to go see them in January, in February, and then you can build on that relationship. There's nothing wrong with that. In fact, I encourage it, because that's what makes the difference between you and the competitor, is that you're building a relationship with them, and that creates that loyalty and longevity in your client base. Okay? But during AEP, for efficiency purposes, that's not the time. The time is to get the enrollment done and do it remotely, efficiently, from home, and get those applications flying in. It might be a little awkward at first. I promise you it will be awkward, but as you get in your groove, you're going to be a machine, because in a given day, on a lucky day, you might be able, if you're a madman, you might be able to see 6 to 8 appointments in a day. Okay? With this new efficiency working from home and the ability to do remote presentations and open enrollment, you can do upwards of maybe 15 applications a day. I mean, that's incredible. You can get a lot done in a single day when you really carve out all the windshield time, drive time, and wasted time that in previous AEPs was kind of necessary because we had to go see our clients. So use that time wisely and ensure that you're doing that efficiently. Now, on the 15th, that's when you start attacking your prospects, people that you really don't know, that you met for the first time, that you talked to throughout the year, and you're going to get those people enrolled, after the 15th. So you could start stacking up your appointments in that fashion. So that really should be the strategy. Right now, calling your book, setting up your appointments from October 1st and forward, getting organized, getting all your marketing materials up and running, and attacking that book of business. Let me remind you guys, the number one lead source is client referrals. So how do you generate client referrals? You've got to be in front of your clients. Please remember, it's not your client's job to remember you. It is your job to remind them of what you do. I think that rhymes, so I'm going to write it down one day. But that's how it works, guys, okay? So postcards, text messages, email, phone calls, whatever it is to get in front of your members, do it. Do it, and do it now. Don't wait. You should have all your certifications done. If you haven't got those done, get those out of the way, and then start attacking your book of business and getting in front of them, okay? And then your leads and marketing, anything else that's left for your leads and marketing, we're going to talk about that on a different call. But I will tell you that it is a different world out there. Social media is going to be a great friend. And I'm going to tell you, client referrals you know, as you're getting off the phone with each one of your members that you're enrolling and say, look, can I ask you for a favor? Can you do me a favor? Right now is a difficult time for marketing. I lost my Walmart. I don't have my kiosk. I can't go see my doctors. You know, it's an awkward time. So if you could tell a few people about me and let them know what I do out here, I would really appreciate that. So ask your clients for referrals. I know a lot of you are not asking. You know, either you're shy or you forget or you're running around and off to the next appointment. I get it. But build that into your presentation. Build it in as your closer. Okay, build that into what you say, your elevator pitch. What is it? Why should they work with you? And best really is if they're calling you now and they're having issues. I love issues because if I'm able to solve it and say, you know what, Mrs. Jones, how did I do today? I did great. Thank you. Very much appreciate it. I would really like if you can help me with something now. Can you tell a few people about me? Can you give them my cell phone number? Can you give my email address and let them know that I'm out here and I help people with their insurance options? That's, you know, some of these folks have not a lot to do, you know, and it gives them purpose and drive to help you, spread the good word about health insurance and what it can do. Okay, and we're getting into busy season because we've got Thanksgiving coming up. We've got a lot of Christian and Jewish religious days coming up, and it gets entangled in all that. So, you know, get your job done early, and then you can worry about prospecting around the holidays, because it's going to be a lot easier to do this stuff if you can work remotely from anywhere, really. You know, and I think that's a really important thing to do, is just making sure that you're using your time wisely and doing the best you can for marketing and advertising. All right. So with that, I am done with the call this morning, right on time. So I'm going to open it up for questions. So bear with me as I grab everyone off of mute. All right. Good morning, everyone. Does anyone have any questions for me?
Justin, it's Mary. I have a question.
Sure
Concerning Freedom and Optimum, do we have to do a face-to-face with them again?
Yeah. They are doing that remotely, but yes, ma'am, they do require a training. They did one on Thursday of last week, but just check that training calendar because there will be some additional ones popping up.
Okay.
Absolutely. I don't have the dates just yet, but what you can do if you're anxious and you want to find out the next one, you can call broker support at Freedom, and it's on their website, VIPagentsupport.com, and it's also in your portal too. They have a training calendar there as well. Yep.
Thank you.
You're welcome.
November, October, September. He needs to do it in September.
All right. Looks like Kathy's already working.
Do it by phone.
Any other questions this morning?
Yes. Justin, good morning.
Good morning, Pedro.
My question is the enrollment checklist, pre-enrollment checklist. That is in all. I don't think that is in all sales kits. So, I mean, it's required to leave that with the customer, right? What is the purpose of that? That they check if everything was done, I mean, all that they needed was covered. That's the idea?
Yeah, and you're referring to Freedom. So that's actually a Freedom requirement for the Freedom plan and Optimum. Not all carriers require a pre-enrollment checklist to be left behind with the member, but some carriers do. So just make sure that you're watching that on which carriers. And I think the only one at this moment that is requiring that pre-enrollment checklist is Freedom. And I believe it will also be on the actual application on the enrollment when you do the e-app. So it'll be there for you. But the purpose of that is, number one, to ensure that you did cover everything that was necessary. So you went through the formulary, you checked the doctors, you explained that it's an HMO, you know, so on and so forth. And then it's kind of like a CYA, you know, it's covering you, right? So if you leave it behind with the member and compliance, they have a compliance issue and they call the member and they say, did they leave you a pre-enrollment checklist? Can you send that to us? You know, there's a copy of it left behind, so it ensures that you did what was necessary in the appointment. So there's several reasons for that, but really it also solidifies in the client's mind that you checked all the boxes and you did absolutely what you needed to do in order to ensure that that they had a good experience in the enrollment time.
Yeah. So who should check the boxes? The agent or the customer?
You are okay to check the boxes.
The customer, right?
Well, they do have to
check.
Yeah. It's not a required document for them to sign because you're not taking it with you. You're actually leaving it with the member. Right.
Yes. Okay. Thanks.
You got it. Great question. All right. Any other questions this morning?
When do you, by the way, the other question is, when do you upload this recording? Today or tomorrow?
I believe I will be recording this one or uploading it today. I try to get them uploaded by Monday. Sometimes they don't come out until Tuesday, but usually no later than Tuesday is when I upload the recording. So if you're subscribed to the YouTube channel, what happens is you'll get a notification that a new video has been uploaded. So if you're ever out in the field, because I'm going to do my best to do these throughout AEP as well, but there may be times where you guys are busy on a Monday morning, and I get it, so you're not able to attend. So that's why I want to record them. And if you're subscribed to YouTube, you'll be able to get those notifications, and it'll let you know, hey, Justin uploaded a new video with all the new information on what's going on this week.
Oh, very good. Okay, thanks.
You got it. Absolutely. Okay, any other questions? Last call? All right. Well, I appreciate everyone for being on the call this morning. It is that time, so work hard, get through that book of business, get organized, and have a fantastic and successful week this week. Thank you guys, and have a great day.